So, what is the cause of most chronic pain? If you or someone you care about is in chronic pain, I encourage you to listen in on the next few minutes and learn what science is beginning to uncover about this epidemic. Hi, I'm Dr. Mario Mancini, the Medical Director of the Center for Integrative Care, a functional medicine and peak performance center here in San Diego. Now, the research is demonstrating more and more that a strong driver of chronic pain is due to a problem in the nervous system itself, leading to what is called neuropathic pain. So, in order to understand this concept, let me first give you a little better understanding about this animal we call pain. See, when you have an injury, a sprain, strain, fracture, muscle tension, inflammation, spasm, you have a nerve signal that fires off. When that happens, the signal tells the brain, ouch! Now, we understand through science that there is a secondary nerve that is involved in this process that is most often the culprit. And this has been found to be one of the primary reasons why most people get stuck in a chronic pain cycle, which of course leads to increased stress. Now, this nerve is called the proprioceptive nerve, but I want you to think of it like your GPS system, because it tells the brain where the problem is. When this nerve is faulty, the brain is saying, I hurt, but I don't know where the problem is. Now, why is that important? Well, because the brain needs to know exactly where the problem is, so we can release what are called enkephalins, the body's natural painkillers. So there are two nerves. One is the ouch nerve and the other is the GPS nerve. Now a question you may be asking is, well, why is this nerve becoming faulty? Well, there's a couple reasons why, and it's been found in the scientific literature. The first is an old injury that's never provided an opportunity to heal, most often due to continuous demands placed on it after an injury occurred. A majority of work injuries that we treat fit under this area because of this one driver. The second is chronic fatigue. This tells us the body does not have the energy resources to maintain normal function, not to mention repair and restoring injured areas. The third is commonly missed aggravator, which are atmospheric pressure changes. In other words, these people can tell you the weather better than a weatherman can. They are so sensitive, and this sensitivity often re-aggravates and extends the duration of inflammation pain cycle. Now, the last one I found to be the underlying driver in most patients that I've seen over the past 19 years. That one factor is chronic stress. More specifically, what is called a sympathetically maintained stress response, which simply means it's fueled by a combination of physical, biochemical, and emotional stress. It's like a tsunami and an earthquake that hit at one point in time, and now what you continue to experience are the waves and aftershocks for long periods of time. And to make matters worse, as you continue to get hits of emotional stress from life demands and chemical stress from, say, eating the wrong foods, it reactivates those waves and aftershocks. When this happens, the system becomes faulty, simply due to the fact of excessive bombarding demands going beyond the body's ability to recover. The body can't catch up. So why does this cause a problem? Because the body was not meant to manage long-term bombarding stress. The end product, the system gets overloaded and faulty. Being faulty, there's no clear signal telling the brain to release these powerful painkillers. So, the key to turning on the system is to reboot and reactivate this faulty nerve. Now listen closely. A medical modality that is being utilized more and more for this specific reason is biomedical acupuncture. Why? Because through the use of acupuncture, we are reactivating this faulty GPS nerve. This then turns on the brain to begin to release these powerful painkillers from the brain. See, a majority of chronic pain cases that are referred to our center from a medical doctor do not have a clear structural cause. Now, there was an initial injury, but most often what we see is that the magnitude and chronicity of symptoms are not consistent with the condition. In other words, the patient shouldn't still be having the pain. When this is the case, most of the time the patient is suffering what we call neuropathic pain. This means that the problem is in the nerve or the nervous system, and there's really nothing pushing on the nerve itself. Now, interestingly, the body can lock into these chronic patterns of pain where the nerve keeps firing without any direct trauma. This type of looping pain is in fact responsible for most chronic pain that patients experience. This is why most often after many tests, you're told that they do not know exactly why the pain is still there. And this is where biomedical acupuncture may be an excellent option. Why? Because it is both diagnostic and therapeutic. In other words, within a short course of treatment, normally within about 6 to 12 treatments, we not only begin to see changes, but more importantly, it will tell us if the body will respond and do well with further treatment. So, if you'd like to find out more about how we can assist you with your specific health concerns through the use of biomedical acupuncture, along with your current health care in a safe and effective way, contact our office to schedule a free consultation where we can answer any questions you have to find out if and how we can help you with your healthcare needs. I'm Dr. Mario Mancini, and I wish you the best.